Let's focus in on coronavirus inside the hospitals now in New Jersey, where University Hospital in Newark soon will require all staff to be vaccinated. Joining us now, President and CEO of University Hospital in Newark, New Jersey, Dr. Sharif El-Nahal. Dr. El-Nahal, it's great to have you back this morning. We spoke 2 days ago to Mayor Bill de Blasio of New York City, who's putting in a citywide rule that if you work in a hospital, you have to be vaccinated. Your hospital taking that same step in Newark, New Jersey. Explain the decision.
Well, thanks so much for having me. I think it's a very wise move. I made the decision because I just simply could not abide by the risk of my staff spreading it to each other, but certainly also spreading it to the most vulnerable folks in the community, to COVID-19, our patients. We now have vaccines that have been given to over 150 million people in this country. Real-world effectiveness is sky high, and they are overwhelmingly safe. So if we are going to be providing health care, we have to be the ones to set the example and certainly to keep each other and the community safe. So I strongly support Mayor de Blasio's move there.
Yeah, it makes a lot of sense to most people. I think, obviously, shaming and condescending to people who are not getting the vaccine isn't probably the best way to persuade them to get it. So what do you say to people who are hesitant? I think it surprises a lot of people that a doctor or a nurse wouldn't get it, knowing the ravages of COVID, having seen it with her or his own eyes. So what do you say to those who are hesitant?
So I'll say one thing. Our mandate kicks in about 10 days. And in the lead up to the mandate, I've been having lunches with groups of employees who are unvaccinated. And I just had one of those lunches last week. Within a week, and again, remember, these are folks who were not vaccinated, were skeptical. Almost all of them had gotten the shot. You can have these conversations on a personal level. And if you come with credibility and you come with the facts, to this day, you can get people through that journey. You can't do this from the podium, and you can't do this on camera nearly as effectively as you can on a personal level. And the Surgeon General released a report recently about misinformation and spelled out the role that everybody can take in having these personal conversations with their loved ones, with their community members, and certainly with their doctors and healthcare professionals who know what they're talking about. So I really urge everybody to read that report and take the advice.
If you don't mind, Dr. El-Nahal, taking us inside some of those lunches you had, because I think it can be instructive to a lot of people, not just working in hospitals, but talking to friends and neighbors and family members. What do you tell someone who has read something online that the vaccine is going to make them more sick, or that they're putting a microchip in your arm, or that Bill Gates and Dr. Fauci are getting rich, all the garbage that's online? How do you sit down in a room and convince someone to get the vaccine?
Well, the first thing I'll say is that this is why the person having these conversations needs to be trusted, needs to have that baseline level of trust with whoever's across the table from them who's skeptical about the vaccine. Trust means that people will believe you. And simply dispelling notions like, hey, these vaccines make you infertile, or even the more extreme claims about surveillance or what have you on these vaccines, you can easily dispel those things if you have that baseline level of trust, which is why it requires everybody in our communities, and certainly our healthcare professionals and healthcare institutions, to set the example. So I really do think, and we're proving this every day with the canvassing that we're doing before mobile vaccination events, going door to door, these conversations can be simply a few minutes, and you can get people through the end of their journey and get them to accept the vaccine. So again, everyone should be taking that personal responsibility, not only getting vaccinated themselves, but having those tough conversations with folks who are skeptical. And everybody has folks in their lives who are skeptical about this vaccine, myself included. So really do take that advice.
Doctor, two questions. First of all, I'm curious, not who, but what the conversation is with the hospital worker who refuses to get vaccinated, still working in a hospital, seeing firsthand the results of this virus. Can you share with us what the pushback is, what the reasoning is to not get the vaccine, and where are they getting their information?
It's a good question because it spells out how dangerous misinformation and disinformation is, even for folks who are in a healthcare setting every day or even have some level of healthcare training, certification, degrees, are susceptible to misinformation and disinformation on Facebook and on social media. And I've seen that firsthand in discussing with my employees the concerns about side effects that aren't real, the concerns about adverse events that just simply don't exist. These things can pervade even into a group of healthcare professionals. So that Surgeon General focus, the fact that every level of leadership should be focused on having these conversations, dispelling misinformation, and everybody doing their part to do so can never be more important.
And I'll start with one issue. I just want to get your weigh-in on this. I mean, I've heard from people in the medical community that there is controversy over whether or not pregnant women should get the vaccine. Should pregnant women get the vaccine at any time in the pregnancy?
Well, the recommendation that I'm aware of from the American College of Obstetrics and Gynecology is that the vaccine is recommended for pregnant women, and here's why. Getting vaccinated is a choice, but not getting vaccinated is also a choice. And remember that COVID-19 can have significant risks to pregnant women, not only to themselves, but to their unborn child. Premature births, other adverse birth outcomes are more likely with COVID-19. And so we don't know yet the long-term effects of this vaccine, but remember the history of vaccines and try to think of a clear example of a vaccine causing a long-term side effect. It's really difficult to do so. And so I think that's what informs that recommendation, and that's what I tell our pregnant employees who've been concerned about this. But I think we really have to get behind the professionals who know about this, and I endorse the Professional Society's recommendation.
All right, Dr. Sherif El-Nahal, thank you very much for coming on the show this morning. We will see you soon.